Hello, everyone. I'm Dr. John Lee. After 40 years in medical practice, if there's one thing I've learned, it's that our brains are not static machines. They are dynamic, living systems. I often hear from my patients, "Doctor, I'm worried about my memory. Is Alzheimer's just inevitable as I age?" My answer is always the same. While we cannot control every variable, we are not helpless. Science has advanced significantly, and we now have a much clearer map of what works to protect our cognitive function. Today, I want to share 5 habits that are grounded in the latest research-proven steps you can take right now to build a more resilient brain. Habit number 1, regular, sustained physical activity. You've heard it before, but the why is the missing piece. When you exercise, you aren't just burning calories. You're increasing blood flow to the brain and promoting the release of neurotrophic factors, proteins that act like fertilizer for your brain cells. The goal? 150 minutes of moderate activity per week. That's just 20 to 25 minutes a day. Whether it's a brisk walk, dancing, or swimming, find something that gets your heart rate up. Remember, what is good for the heart is, without question, good for the brain. Habit number 2, the brain defense diet. In my own life and in my research, I've seen the impact of the Mediterranean and Mind diets. These aren't fad diets. They are patterns of eating rich in antioxidants, especially those found in berries, leafy greens, and omega-3 fatty acids from fish. Try to use olive oil as your primary fat, and aim for 3 servings of whole grains, fruits, and vegetables every single day. Think of your plate as a foundation for your cognition. When you minimize processed sugars and fried foods, you're reducing the systemic inflammation that we now know is a major driver of cognitive decline. Habit number 3, lifelong cognitive engagement. Many people think a daily crossword is enough. That's a good start, but it's not the full picture. The brain thrives on novelty and challenge. If you're a lifelong reader, try learning a new language or picking up a musical instrument. If you're not artsy, take a class on a topic you know nothing about. The goal is to force your brain to create new neural pathways. Research shows that lifetime cognitive enrichment can lower the risk of dementia by as much as 38%. Be curious. It's the best medicine for a sharp mind. Habit number 4, treat hearing and vision loss. This is one I emphasize in every exam room. Hearing loss is a major, often overlooked risk factor for dementia. When your ears struggle to pick up sound, your brain has to work overtime just to interpret basic conversation, which leaves fewer resources for thinking and memory. Furthermore, social isolation often follows hearing and vision loss. If you're struggling to hear or see, please see a specialist. Using hearing aids or updated corrective lenses is not a sign of aging. It's a proactive strategy to keep your brain connected and engaged. Finally, habit number 5, protect your rest and your circle. Sleep is when your brain cleans itself, washing away the proteins linked to Alzheimer's. Aim for 7 to 9 hours of quality sleep. And just as importantly, stay socially connected. Loneliness is a significant stressor. Whether it's a phone call with a friend, joining a club, or volunteering, human connection is a fundamental requirement for a healthy brain. You don't have to do all of this perfectly, all at once. Start with one habit. Maybe today you go for a walk. Tomorrow you choose a salad. Each small step is a deposit into your brain's reserve tank. Thank you for trusting me with your time today. Keep learning, keep moving, and most importantly, stay kind to yourself. I'm Dr. John Lee, and this is Everyday Health Hacks. See you next time.